Hello everybody, my name is Dr. Jacobs. I'm a doctor of physical therapy. I'm also the inventor of advanced soft tissue release. I'm a cancer survivor and I used to suffer from chronic fatigue, migraines, headaches, and pain before I invented ASTR specialty. I have 5 goals for this video. The first goal is to give you a quick overview of normal healing cycle. Second goal, to learn how scar tissue formed in the body. Third goal, to know which patient actually gets scar tissue. Fourth goal is to go over current treatment model for scar tissue and review some of the studies on those models. The fifth goal, the last goal, is to provide you with the best solution for scar tissue release. For visualization, I will use a paper cut example, but the same healing process happened internally with any accident, trauma, poor posture, poor body mechanic, stress, or surgery. So first stage is the inflammation. As you see in the image, there's redness, increased temperature, also the blood starts to rush to that area, pain occur, loss of function. Second stage is the proliferation stage. That's when the body starts to build the scar tissue to heal the wound, so it will cover. If our body does not build the scar tissue, it's open wound susceptible for infection. So scar tissue is very essential for our survival. And during this stage, it's not only scar tissue occur, it's also there's a fascial restrictions, there is a muscle spasm, there is a trigger points. I will go over the fascial restriction, muscle spasm, and trigger points in future videos, but the goal of this video is to actually dissect the scar tissue, the fibrosis section of the healing cycle. It's a very complex process, but I will just try to simplify it. And so lastly is the maturation stage. That's when the body starts to get rid of the scar tissue by itself and everything starts to clear up. This process could take days, weeks, months, or years. As we get older, our body ability to get to maturation stage decrease significantly. And a lot of the patients we see currently, they actually stuck either in the proliferation or the inflammation, or they actually their body going back and forth between the proliferation and the inflammation stage. So today we're just going to focus on the proliferation, the fibrosis part of the proliferation. So to understand the proliferation, I'll just go over a few definitions or a few things that we need to understand to know how things works. So first thing is the extracellular matrix. The extracellular matrix is a collection of extracellular molecules secreted by cells, provides biomechanical and also structure support to the surrounding cells. So the function of the ECM or the extracellular matrix is to support the cell that's around it and also to provide separation between those cells. And lastly, it's also provide intracellular communication. So the extracellular matrix is provide the channel that actually provide communication between the cells, also provide separation. So what is fibroblast? Fibroblast is the cells that synthesizes the extracellular matrix and collagen. It's the primary element of the repair process. So the function of the fibroblast is to maintain the structural integrity of connective tissue, and it mediates the repair phase. So the fibroblast produce structure protein used to tissue reproduction and remodeling. So think about this way: the fibroblasts are the cells that actually build the fibrosis, that keep the tissue healthy together or connected together. When you look at the external cut, when you start to see the wound closing, that's from the fibroblast that start to build fibrosis to heal. So that's what the fibroblast cells does. It's just rebuilding and repairing the tear area or the injury. So you can look at the image, and on the screen it shows the phases of wound healing. And this process is actually happen for wound and actually happen internally when someone gets injured. So when you look, there's 3 stages. What we talked about before is the inflammation, the proliferation, and the maturation. And you can see there's several lines in the middle, and it shows that in the first stage, the inflammation, the white blood cells start to be active to attack any foreign objects. So I want you to look at the red line, and that's the fibroblast, and that's occur at the end of the inflammation, and it's actually decreased by the time we go to the maturation stage, and that's what we focusing on in this video, the scar tissue, the fibrosis. So the other thing we need to know is the myofibroblast and how it formed. So it starts with the fibroblast that goes through a 2-step progression from fibroblast to fully differentiated myofibroblast, triggered by a TGF beta 1 protein. So the myofibroblast cause wound to contraction. When someone has like severe, externally you can see that when you have like trauma or accident or surgeries or several cuts, the contracture of the tissue, everything is start to stick together, not separate tissue. So it's actually restrict range of motion, decrease mobility, increase pain, and so on. So why scar tissue or fibrosis could be an issue? So think about this. Our muscle should act like a rubber band. When it contracts and relaxes, it's stretched like this. So when you have a scar tissue or fibrosis, it's like you have a knot in a rubber band. So when your muscle contract, does not stretch much. So when that happens, you start to have decreased range of motion, increased pain, and the scar tissue could compress on nerve, artery, decrease blood flow, and could stimulate like nerve symptoms. So scar tissue is very essential to treat with majority of the musculoskeletal injury. Which patient has a scar tissue? Everybody. So when someone have like jaw pain, neck pain, sciatica, arthritis, headaches, fibromyalgia, carpal tunnel syndrome, tendonitis, bursitis, plantar fasciitis, and the list go on. With any injury, the body has to go through those 3 stages of healing. If it's healed, if it does not heal, it goes through 2 stages and just stuck, either inflammation or proliferation, or usually it's going back and forth between inflammation and proliferation, because the inflammation will cause scar tissue and fascial restriction, muscle spasm, and trigger point. And the existence of this cascade, they actually cause more inflammation. So the chronic condition will be, the patient will experience this condition going back and forth. It's a vicious cycle. That's why therapists need to be trained to actually address the inflammation and the proliferation simultaneously with a lot of chronic conditions. What's currently used to treat scar tissue? There's 3 approaches for scar tissue currently exist. Massage, one of them. The second one, metal instrument, and the third one, plastic instruments. So let's go over the current studies so we know which treatment is most effective. So I will just review one study, but there is a ton of studies that shows the massage is actually temporary pain relief short term, but I will just present one of them. Massage therapy for neck and shoulder pain. This is a systematic review, meta-analysis. They looked at a lot of studies on massage and the effect of neck and back and shoulder pain. They concluded that No evidence suggests that the massage therapy was effective in improving functional status related to neck and shoulder pain. Okay, so let's look at, so massage is not very effective for relief shoulder or neck pain. And I answered this question, why it's not effective, in the first video for conquering chronic pain. That's an overview of the whole series that I'm actually presenting like on almost weekly basis. So we just covered massage is not very effective to treat the source of the problem. So there's high chances not really working on the scar tissue. The other tools being used by therapists to break the scar tissue is like instruments, some of them metal, others plastic. So let's look at what studies done on those instruments and what they found. So this study is a systematic review. They reviewed randomized controlled trials on instrument assisted soft tissue mobilization, which is the instrument used to break the scar tissue. And what they found that the current evidence of randomized controlled trials does not support the efficacy of STEM, which is instrument assisted soft tissue mobilization, for treating certain musculoskeletal pathologies. There is weak evidence supporting the efficacy of STEM for increasing lower extremity joint range of motion for short period of time. So they don't even get short-term effect with those instruments based on the studies. So we went over just a few studies on the efficacy of current treatment for releasing scar tissue. So the first thing we found that based on the study is not effective. Okay. So the second thing I found that a lot of those classes that they teach instrument assistive soft tissue mobilization or using instruments, they actually believe to stimulate the inflammation stage, which actually does not make any sense, because if someone has a scar tissue and you cause more inflammation, the cycle has to go downward to the proliferation stage. So when we stimulate more inflammation, the body will build a new fibrosis and scar tissue. How the practitioner guarantee the new fibrosis or the new scar tissue is less than the old ones, which actually does not make any sense to cause more inflammation to actually break scar tissue. So that's one of the problems that I have with current instrument. So with the first problem I have with it's not effective based on the studies. The second problem, they actually causing more inflammation, which actually causing more scar tissue. It's a vicious cycle that actually making patient worse. Our goal as a healthcare provider is to do no harm and help patient. So please, if you use an instrument, do not cause inflammation. The third problem that I found with the current instrument, and you can see it in the picture, the design is not really ergonomically designed for practitioner to use, and it has sharp edges. It's a very rough. It's poorly designed to be used by therapists. So I had this conversation with a therapist that used those instruments for 3 months, and she told me that after using those instruments for 3 months, she had trigger fingers because it's poorly designed. The other issue I had with the current instrument, it's hard to evaluate the scar tissue. So the design is really not very helpful, and I had to go over 100 prototype and design to be able to feel the scar tissue with the instrument. So the instrument not very good tool actually for evaluation. And if the therapist does not feel it much with the instrument, how they treat it? It's just treating without feeling. That if you don't feel it, it's not really, you don't know if you release it or not. So what the solution? So what I had to do is actually reinvent or invent a new instrument ergonomically designed to break the scar tissue. So I had to think about the therapist, about myself. When I work on patient, I need to use an instrument that does not cause trigger fingers, or very easy to use. That's one of the things that I had to look at when I was designing the instrument. Second, I don't want the instrument to cause inflammation, and in the training I had to train therapists to be very sensitive to the inflammation and not causing inflammation. Thirdly, the design has to be in certain size that actually will help to detect the scar tissue, and I was able to achieve that with the current instrument I have. And there's several patents on the instrument I have that use for scar tissue, for fascia restriction, and so on. For example, Tom had a motor vehicle accident. So when he had the accident, he started to experience neck pain. So I'm going over this process that happened internally, but you can visualize it with the paper cut. So in the first stage, he started to have inflammation, swelling, redness in that area. The second stage is actually his body started to build a scar tissue around the micro tear areas in the muscle. During that event, it started to have like fascia restrictions, he started to have muscle spasm and tightness in his neck, and he started to have trigger points also. So after that happened, he started to slouch forward and adapt a bad habit that lead to poor posture and poor body mechanics. And during this event, he started to stress out because he's not able to work properly, or he has a lot of discomfort during work, and he has a lot of stress because his car is totaled. And then he started to not eating the proper diet that will help his body to heal, so his diet was affected too. So when we look at this event or at Tom accident, there's 10 elements occur with that accident. When you look at the screen, there's inflammations. Start with inflammation, then start to have a scar tissue, fascia restrictions, trigger points, muscle spasm, poor posture, poor body mechanics, sometimes gait problems, and then he started to have nutrition issue because he's not eating the proper diet, a lot of stress and anxiety that was involved with in this scenario. At the end, there's lifestyle changes that lead to the chronic condition to be continuous. So through ASTR treatment, I addressed the 10 elements of the problem simultaneously, and I figured out a way to really address it in 2 to 3 treatments. So most of the patient, when I see them, we address those 10 elements in 2 to 3 treatment. I had to reinvent the manual therapy actually to get a good result in very short period of time. And feel free to check the real treatment videos that I posted on YouTube channel, so you can see the manual part of it. But behind the scene, I actually go over those 10 elements, and I figure out to have protocol for several conditions like tension headaches or migraine headaches. I have protocol for that. Fibromyalgia, protocol for that. Sciatica, back pain. Those protocols I developed through in the period of over 6 years, based on the fastest, most efficient way to relieve pain. And so far, these are really working very well for the patient, and I'm constantly working on more protocol, or if I found a better way of getting patient better, I actually update those protocol, and I teach it in my classes to the healthcare providers, and constantly work on a new invention, new instrument. Feel free to subscribe to my channel. You will get updates about helpful tips and tricks on how to relieve pain. Also, there's over 150 videos that for ASTR treatment, real ASTR treatment. You can actually see the instrument that I invented and the result I get with my patient. Also, if you are a healthcare provider and you are interested to be ASTR licensed provider, feel free to click the link below to register for next class. I also included a link for my TEDx talks that I shared how I discover ASTR treatment. See you soon.